Hi friends, welcome to classes by Lab Doctor. In today's class, let us try and understand what is the normal range of this LDL and how do we reduce the LDL levels in our body. So you all know that LDL is a bad cholesterol, so we do not expect its level to be very high in the body. So because this LDL has an atherogenic potential, it can cause stroke, it can cause peripheral vascular disease. We try to keep the LDL level as low as possible. So the normal range of LDL would be less than 100 milligram per deciliter. So this less than 100 milligram per deciliter is for people who have no previous history of heart attack, who have not undergone any angioplasty, who have not undergone any stent placement, etc. Suppose if such risks are there, we expect that the LDL level in them should be less than 70 milligram per deciliter. These LDL levels are very important when we are selecting a treatment goal also. When we put a patient on any treatment, our aim will be that we will see that LDL levels are below certain range so that we know that this patient's treatment is successful and he is not at risk for developing any kind of a cardiac disease or any kind of a heart attack, etc. So LDL level of less than 100 milligram per deciliter is optimum. If it is between 100 to 129 milligram, that is fairly good. If it is between 130 to 159, it is borderline high. If it is between 160 to 189, it is high, and if it is more than 190, then it is very high. So if it is almost double, then it is very high level of bad cholesterol or the LDL cholesterol. So I've told you that when we see the ranges of this LDL, we consider something called as a atherosclerotic cardiovascular disease risk. That means we want to see what is the risk of this patient developing a heart attack or a stroke, etc. Suppose a low risk category in this atherosclerotic cardiovascular disease ASCVD is when we say that the chance of that person getting heart attack is less than 5%. That is low risk ASCVD. Moderate risk ASCVD is when the risk of that person getting heart attack in within 10 years is around 7.5 to 20%. So there is a moderate chance that he will experience like such a cardiovascular event like heart attack or stroke within the next 10 years. And high risk ASCVD is within a gap of 10 years. This patient has a high risk. That means risk of more than 20%, he might develop this kind of a heart attack or a stroke, etc. And extremely high risk is when there is a very high potential for cardiovascular events, like or it is more than 30% or greater for a 10-year risk for major adverse cardiovascular events. So this is how we classify the risk category in ASCVD. And when we put these patients on treatment, we expect that in a low risk ASCVD patient, we expect that his LDL cholesterol is less than 100 milligram. If he is a moderate risk patient, we know that his chances of getting an heart attack in the next 10 years would be around 7.5 to 20. Suppose if it is high, if it is coming more than 20, we expect that his LDL level is less than 70. Suppose if it is very high, or if it is extremely high, we expect it to be less than 50 milligram per deciliter. So this level of LDL becomes important when we even put the treatment goal for treating the patient. So LDL should be less than 100 when the risk is low, but when the risk of getting an heart attack is very high, the treatment goal of reducing the LDL should be less than 30 to 50 milligram per deciliter. So this is what I was telling you. This is low risk, this is moderate risk, high risk, very high risk, and extreme risk. And you can see this is less than 5%, 5 to 10%, then 20 to 30%, and more than 30%. So this is how the risk categories are categorized. So now, what are the causes for high LDL levels? So there are many factors which can elevate your LDL levels, but main thing is what you eat. Suppose if you are eating food which are rich in fat, which are having more of sugar, more of salt, increased carbohydrate intake also, more than what is required for your body. If you are eating more calories than what you are burning inside your body, then your overall cholesterol or your LDL cholesterol is bound to rise. Especially you are having high amount of saturated fats, trans fats, etc., that will raise your bad cholesterol. So main thing is your diet. What you eat, it determines what kind of a cholesterol is rising in your body. Your body weight, suppose you are obese, you are overweight, this all can rise your LDL level. Third would be your sedentary lifestyle. You are not active, you are not moving. So this also will lead to increased LDL or increased bad cholesterol level in the body. You are consuming a lot of tobacco products, you are a heavy smoker, all this can reduce the good cholesterol and rise the bad cholesterol level. There are certain medications like you have your beta blockers, your thiazide diuretics, your HIV medicines, etc. All these can also rise your LDL levels. Suppose if you are having diabetes and that is uncontrolled diabetes can change your lipid metabolism and the LDL level can go high. Similarly, chronic kidney disease. Chronic kidney disease can change your LDL, and increase LDL can cause your chronic kidney disease. Because if the LDL level increases, the renal vessels can be involved. There can be renal artery stenosis, renal atherosclerosis. Again, the kidney function can go down. As we age, the LDL level naturally tends to get higher. In females before menopause, compared to men, the LDL levels are less. But after menopause, the levels of LDL tend to go higher. That is why in females, the after menopause, the chances of heart attack are equal to that of a man. So gender also can play a role, and genes. Sometimes if there is any member, biological family member, they are having high cholesterol, there is a history of such heart disease in the family, that can also increase your risk of getting an heart disease or risk of developing this kind of increased LDL levels. So these are all the causes of high LDL levels. So now, how do we lower the LDL cholesterol? So one is your diet. Your diet has to be as much as possible, we have to keep it a balanced diet. There should be adequate portion of your carbohydrates, proteins, and fats. Because yes, we do require fats. We cannot completely remove the fats from our food. So we require a balanced amount of carbohydrate, proteins, and your fat. We have to include a lot of vegetables, fruits, because they will give you fiber, they will give you nutrients, they will give you minerals, they will give you antioxidants. So you will have to include these fruits and vegetables in your diet. You can include omega-3 fatty acids like your nuts, your fish oil, etc. They will increase the HDL and they will also reduce your LDL. So omega-3 fatty acids are important to be added in your food. Yes, then there are certain food we have to avoid. Like if you are having a lot of sugary food, if you are having a lot of bakery products, lot of maida products, like you are having a lot of chips, biscuits, toasts, donuts, pizzas, burgers, there should be a reduction in consumption of these kind of fats and these kind of junk products which are going to rise your LDL level. Your salt consumption should be less, because that also can increase your LDL level. There should be smoking which has to be reduced. Alcoholism, that has to be reduced. you will have to move more. There has to be some form of an exercise. At least 30 to 40 minutes of exercise every day should be there. And this exercise has to be a combination of low intensity, moderate intensity and high intensity. So you have to combine walking with some amount of jogging, some amount of strength training, yoga, etc., so that you get the full benefit. Your muscles are strengthened, your bones are strengthened, they are able to utilize this cholesterol, etc., properly, and they are able to clean up this bad cholesterol also. So having an exercise routine becomes important. Maintaining an ideal body weight becomes important, because if you are overweight, then yes, you are having a chances of developing a lot many diseases, including your heart disease. So maintaining a BMI or maintaining a body weight is also important. If at all there is increased level of LDL, then taking the tablets, taking the medicines prescribed by your doctor regularly, that also is very important. And last but not the least would be your stress management. Yes, stress has to be managed, and the cheapest and the best way to manage stress would be your sleep. Getting a quality sleep of 7 to 8 hours. So I've told you, eat heart healthy foods. You include fruits, vegetables. Avoid tobacco use of any kind. It could be tobacco like cigarette, BDs, vaping, etc. Any kind of a tobacco consumption should be reduced. Get more of a physical activity. Aim for 30 to 40 minutes of an activity. Include and juggle between moderate, low intensity and high intensity workout. That will help you to strengthen your heart muscles also. Maintain the weight that is healthy for you, and lower your stress, so that your LDL level also is reduced. And discuss with your doctor for the medicines which can reduce your LDL, and please take the medicines also regularly, so that they act and reduce your LDL levels. So these were few things which you can do to reduce your bad cholesterol or LDL cholesterol. So that was all about LDL cholesterol, the normal ranges and the causes of high LDL, and ways how we can reduce the LDL levels. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.